Hello. I'd like to take this opportunity to first thank the Western and Central Melbourne Integrated Cancer Service, first of all for their sponsorship of this project, but also this opportunity to share it for the first time. This is very much still a work in progress. My Risk Here is really an initiative that started from the Familial Cancer Clinic. This clinic has about 20 years experience in identifying women with a high risk of breast and ovarian cancer, offering them testing and identifying in particular women who carry BRCA1 and BRCA2 mutations. The initial test is often done in an individual who unfortunately has already developed cancer, but we know that our main role is in then cascade testing that mutation, so offering that mutation to other relatives and identifying women young who are well, because by supporting them in undertaking risk mitigation strategies, we know that we can significantly reduce the chances of them either developing or sadly dying of breast and ovarian cancer. In 2017, the government, using the health economic models that we developed, so using the clinical information and the follow-up information that we've got, agreed that it was cost effective to offer BRCA1 and BRCA2 testing in combination with about 6 other genes. And the item number actually allowed any specialist to offer the test. And I think this was done very much with mind of trying to increase that treatment focus, so determining the best chemotherapy or the best surgical approach to women who already have cancer. Anecdotally, we were hearing of women who'd had testing by their specialists, but that their relatives hadn't been followed up. And often the women themselves, particularly if it was one of the more unusual genes the fault was found in, really were kind of slightly lost as to what long-term care they needed. And therefore we thought the most appropriate way to try and empower women would be to actually give the information directly to the woman herself, and therefore empower a more shared decision-making discussion with her specialist. The project My Risk Here is to design a website, an online resource, which provides personalised support and information. Initial focus was on the women with mutations in the 3 highest risk genes, which are BRCA1, BRCA2 and PALB2, and taking a more holistic approach. So our guiding principles were we were trying to ensure equity of access to the knowledge and also an easy way of updating that knowledge as more information became available. We wanted to open access, not requiring a sign up. We wanted the website not only to give the clinical information, but also provide a more holistic approach and also that psychological support that the FCC provides. It needs to be, certainly from the clinical management perspective, clearly evidence-based. And in Australia, we're fortunate to have the national guidelines arranged through the New South Wales Cancer Council EVQ website. And this is a website which has the nationally agreed guidelines for management of women with familial cancer risk. We also felt it was very important, because of this concept of the risk spanning the whole life, that women needed to get different bits of information at an age-appropriate time and also dependent on what their actual risk was, which was dependent on their genetic mutation. We felt that the website should not start trying to reinvent the wheel, and therefore we wanted it to link out with many of the excellent resources that are available. After around 4 to 5 months of planning discussion, we identified 8 domains. Obviously, there's a very clear clinical management guidelines for breast cancer risk and ovarian cancer risk and other cancer risk. Many of these genes also have a lower risk for other cancers as well, which don't tend to have quite as much information associated with them. We wanted psychosocial support, family communication, and grief support. Many of these women go through a terrible sense of loss of their future when they identify as having one of these mutations. And in addition, because of the familial nature, they often have suffered many loss of close relatives as well from breast and ovarian cancer. We also wanted a space where we could then add research studies so that women could then click and see what might be appropriate for them. So having got these 8 domains, I'll just go into particularly the psychosocial ones specifically. We have information based on decision-making about bilateral prophylactic mastectomy. It does feed out into photographs should the woman want to look at that level of detail, but it also discusses possible problems associated with it, the likelihood of having to have surgery because of cosmetic issues further down the line, and also bilateral salpingo-oophorectomy, having your ovaries and fallopian tubes removed often at around the age of 40, puts these women into a premature menopause. And therefore, a lot of the information was around preparing for premature menopause. There's also women struggle a lot with body image post surgery and how this impacts on their relationships. Many of the women we have in our clinic are 18 when they find they have a mutation, and therefore they often, especially if they've lost a mother, consider prophylactic mastectomy at a very young age. And the question is how this then impacts and how to help them soothe the relationship issues that may arise with that when they feel that they want to tell their partner that they carry a mutation. So it's all about setting realistic expectations and trying to support the woman build up resilience to the issues that may occur in her life. We also link out to information about grief, whether death or whether a grief of what women often perceive as loss of a normal life. And we also lead into support structures and how women might want to access these. The reproductive and fertility modules are interesting. We get a lot of questions from particularly general physicians about contraception. Can young women go on to hormone oral contraceptives? What other options are there? A lot to do with family planning. I mean, if you're contemplating having ovaries removed at 40, then you need to think about your values prior to that, and also the impact that being pregnant can have on breast cancer screening. MRI is not possible during breast cancer, during pregnancy. And unfortunately, we do have young women who develop breast cancer because they don't have imaging, and then they breastfeed, which again prevents us arranging MRIs after the baby's born. So all of these items are just highlighted so that the woman knows what conversation she may wish to have with her physician. So the website itself is now being designed by our web designer. This is merely a mock-up I had in the back of my mind when we started the project, that there would be an entry page with each of the modules highlighted, in this case down the left-hand side, so that they could enter one of those and read information about what possible decisions they may have to face in the future. And along the bottom, all the clinical guidelines are based on 5 yearly intervals. So that the 5 years prior to having to consider oophorectomy, there's advice about ensuring that your cholesterol level, your heart healthy, your weight is under control, that your lifestyle factors, that you are empowered to look after your lifestyle factors, as well as links out to the clinical care that you need at that time. At the top, we have a summary in terms of lifetime risk and also risk over the next 5 and 10 years. I think it's important when women make decisions that they make a decision now, and therefore the risk that they're considering at the time is quite a short-term risk. And that ties in with the age at which the woman will enter the website. We have particularly allowed women access in any order because we feel this would also be a resource that a mother might wish to show and discuss with her daughter if the daughter is considering having genetic testing, so that she has a feel for what sort of discussions we're going to have with her when she comes to the clinic. As I said, I think it will look much better. It'll be much more interactive and much more engaging. At this point in the process, we are collecting images that are going in, but we haven't actually placed them in the document themselves. This is a sort of example of one of the documents. So this is for a BRCA2 carrier after the age of 50. We link out to resources that she may be interested in. We try and give all numerical risk in numbers and percentages. We link within the different modules, and I think this is one of the powers of using a website. We can link different modules into different documents so that we really have developed a network between these documents. And many of the extra resources will be hyperlinks that the woman can click on should she wish some more information, should she wish to see some pictures of a woman who's undergone bilateral mastectomy. We have so many women who ask so many questions, and as a familial cancer centre, we feel it's our role to actually be able to answer these questions. And what we're trying to do here is now empower the woman herself to know what questions that she should be having with her specialists, what discussions should she be having. So we're really putting this together to try and empower women, and in doing so, help them manage their cancer risk. We've already had conversations and have had a great deal of interest from the colorectal surgeons and the gastroenterologists, as they feel that this would be something incredibly helpful in their line of work as well. So I think this could be the beginning of something significantly larger, and we would not have been able to do this without the support and the funding. So I'd like to answer any of your questions, should you have it at the moment, and thank you.